Welcome and thank you for visiting my website. I am Dr. Elliot Davis. I provide very special dentistry to many wonderful patients. Please allow me to share what makes my unique approach to dentistry so innovative and effective. I know you had a sneak peek at the start, but you really have to see it and hear it to believe it. Let me explain why his dental care merits being classified as all natural. No healthy tooth enamel will be removed. He's going to have sequential clear aligners, in this case using Invisalign, which will be designed in accordance with the Arch Reformulation Therapy protocol. He's going to have the Manhattan method for the teeth whitening of multi-shade smiles. And he's going to once again have two of his teeth bonded with dental composites. This is his smile. Those two dark yellow teeth certainly stand out. He's not exaggerating or being a hypochondriac. It's been like that for about 15 years when a baseball unfortunately hit his teeth instead of his glove. Look carefully. You'll notice the tips of those teeth have chips. It's not easy to see, but those two front teeth, the yellow one and the one next to it, overlap. It'll be easier to see this from the bird's eye view. And it's not as if he didn't try. He did have bonding done. He also had teeth whitening done. He also had orthodontic therapy done. Clearly, none of those dental treatments yielded results that satisfied the dentist or the patient or his parents. So here's his dilemma. Should he just have the crowns and veneers done that were proposed by his Pennsylvania dentist? His door-to-door commute, should he continue care in my office, would be between 3 and 4 hours each way. My proposed treatment better be worth the effort. And it better work. Wow, how'd we do this? No crowns, no veneers, just arch reformulation therapy with Invisalign, just doing the Manhattan method for the whitening of multi-shade smiles, and some tooth bonding. That was it. He could not remember any time in his life where he was not conscious of his teeth. It had been that long. What we're looking at is when he started and 8 months later at the conclusion of the active therapy of arch reformulation care. So let's look at his top teeth from a bird's eye view. Here's how he started. We could see those two dark teeth, and if you notice there are some blue marking dots throughout his mouth. Ideally, we want that to be as symmetric as possible. That's what we're hoping for, because that'll let us know that his teeth are meeting evenly throughout his mouth. This is what I was talking about before. You could see where the front two teeth, the dark one and the one next to it, have a slight overlap. If you notice, we're seeing a lot more blue in his mouth. That's telling us that his bite is becoming more even and distributed immediately at the end of active therapy. I almost forgot to point out. If you notice, these were the dark yellow teeth. They're starting to blend in pretty well. We also went ahead and we fixed the edges where the teeth chipped and put them back into function. This is where we used some dental composite to bond those fillings into place. Take a moment to appreciate all the changes when we look at the two views from the start and 8 months later, side by side. Let's look at his bite. Few things. That large black space on the right side of the photo, that's the left side of his mouth. He wasn't sure whether the teeth were ever fully corrected from his prior orthodontic treatment or whether his mouth had relapsed once the treatment was finished. He was aware that the gums and his teeth had become more sensitive, but he figured it had something to do with him being away at college and the schedule of being a Division I athlete. Until he saw this photo, he wasn't aware that his gums had receded as much as they had throughout his mouth. He was also unaware of the midline issue with the top and his bottom teeth when they were overlapping each other when he was biting down all the way. Here's the midline issue. the middle of the top two teeth. Here's the middle of the bottom two teeth. 8 months later, active therapy has concluded. Once again, wow, I never get tired at looking at how good his teeth now appear and how much progress we made so naturally and so non-invasively. This was immediately after the active phase of therapy had concluded. Let's go now 2 years after the start of treatment. This is approximately a year and a half of the passive phase of therapy where the teeth are being retained, they're not being actively moved. Unlike a few years ago when he completed his orthodontic therapy, this time his mouth is not relapsing. As a matter of fact, it's just the opposite. It's getting better. While that would be a highly unexpected occurrence with orthodontic care, it's actually a common result with arch reformulation therapy. Let's look at these three snapshots. The top photo was taken when we started. The middle photo was taken immediately after active therapy was concluded 8 months later. The bottom photo was taken 2 years after the start of therapy and approximately a year and a half after active therapy had concluded. Now let's highlight some of the subtle and not so subtle positive changes that have occurred. Of course, his number one goal was to have his two front teeth be less yellow and not stand out. More subtle but still worthy of mention, notice those two lower canine or eye teeth, which now blend in nicely. I pointed out the ones on his right, they're on our left with the arrows pointing to the right. We can say that was mission accomplished thanks to the Manhattan method for teeth whitening. That midline discrepancy, look at the yellow lines. That has pretty much been eliminated. The overall amount of asymmetry has been greatly reduced too. It's now negligible. There's more. His gums are healthier and continuing to improve. I just pointed one arrow. You can look at the three yellow arrows pointing down in his top left on the right side of the photos. So it's not a stretch to say that his gums and bite are both healthier and both are continuing to improve. This is where arch reformulation therapy clearly stands above orthodontic care. According to numerous published review articles by orthodontists about orthodontic treatment, orthodontic care will show signs of significant relapse more than half the time. One recent study by orthodontists, which reviewed prior articles, stated the problem was as high as 70 to 90%. In addition to treatment relapse, it is not uncommon for the bite and health of the gums to become issues after orthodontic care. That's why his initial results after 8 months and the ongoing results during his passive therapy phase are so encouraging and exciting. Aesthetically, these results far surpass what one could have expected from porcelain restorations. Financially, this patient saved many thousands of dollars and would save tens of thousands of dollars throughout his lifetime by having this care. Bottom line, it was certainly worth his efforts and all of those 3 to 4 hour trips that he needed to make to my office to have this care provided. So I trust it's now clear why his care merits being classified as natural and healthful. While some holistic clinicians might disagree, it's because they don't consider the irreversible removal of healthy tooth enamel required for porcelain veneers to be classified as aggressive. Unlike orthodontic care, when the sides of teeth are commonly shaved down to create space for teeth to move, no tooth structure was touched. The existing bone was enhanced and enlarged to make sufficient room for each and every part of each and every tooth. So how's his long-term prognosis? In 2 words, it's excellent. Listen to these numbers. Porcelain crowns and veneers have an expected aesthetic longevity of about 10 to 12 years. So I'll let you do the math. How many times in his lifetime would this 23-year-old have needed to have those veneers replaced? How many of those teeth may at some point have required root canal treatment? What about his issues with the bite? If they were not addressed, Those veneers and crowns would neither improve his subideal bite nor his subideal bone asymmetry. So why is this dentistry so special? The health of his mouth didn't just improve, it continued to get better and better. Another aspect of special dentistry is making it available to the patient. In his case, my treatment was many thousands of dollars less than the treatment proposal made to him by his dentist in Pennsylvania. It's a privilege and a wonderful feeling when I can make treatments both available and affordable. I invite you to enjoy some other patient videos with equally compelling stories. Once again, thank you for taking your valuable time to view this. I am Dr. Elliot Davis. Please stay well, and bye for now.